Hello everybody, welcome back to Urology Solutions with Dr. Vipul. As explained and promised in my previous talk, today I shall be talking about what are the common signs and symptoms associated with kidney stone. Now the commonest sign of kidney stone is pain, which is also the most feared and the most talked about symptom of stone diseases. However, all pain is not stone. There can be other reasons of causing pain in the kidney, and all stones are not always associated with pain. There can be a lot of stones which do not have pain. Now, coming to the cause of stone pain, kidneys do not have any nerve endings. In fact, if a kidney is injured or cut, it will not cause any pain. The capsule or the shell around the kidney is what has nerve endings and is the source of pain. When there is a stone trying to pass out of the kidney, it gets stuck in the urine passage and blocks the kidney. The kidney continues to make urine and accumulate and swell to accommodate the urine, which leads to stretching of the capsule and it causes pain. The other reason of pain can be if there is infection associated with the stone, it will lead to soreness and irritation of the bladder, which may cause the pain. The commonest site of pain is in the renal angle or the flanks, and it may come down in the front to the groin area, even up to the genitals. The pain site and severity has no correlation with the size or location of the pain. There can be small stones with severe pain. There can be large stones with no pain or minimal pain. The stone may be in upper part of the kidney pipe and still cause pain in the lower part, and vice versa. So the size and location of pain does not have any correlation with the site and severity of pain. Now, another important thing to understand is the quality of pain or the characteristic of pain. Usually the stone pain is because of spasms and it comes in colics, which means it gradually builds up to a very strong pain and then comes down to come back again. It can be quite severe. It is usually described by patients as the worst pain of their life. In fact, females who've given normal delivery childbirth also describe that this pain of stone is worse than the pain of delivering stone. Now, talking about pain, one need to understand that there can be a lot of stones which do not cause pain and still cause kidney damage. So, no pain does not always mean no stone. Now, this is important for patients who are on treatment because many of my patients do not come back for a review assuming that since there is no pain, the stone might have gone out. Now, this is a very wrong and a risky assumption. That is why I tell all my patients, pain is in fact a friend of yours because of pain, you came to the hospital, got evaluated, and now are getting treated whether by medicines or surgery, and you're not neglecting your stone and causing internal damage. Apart from pain, there can be other kinds of pain. Apart from the colicky pain, there can be other kinds of pain and other signs and symptoms. For example, many of the patients may have a dull back pain, assuming it to be spine pain. They go to a spine specialist, get evaluated, and they come referred to us for stone pain. Other than that, there can be burning or irritation in urine or even blood in urine, which is usually because of the irritation of the urinary tract epithelium or the inner skin, or because of the injury or infection of the urinary tract. If the stone is low down near the bladder, it will cause bladder irritation, which will lead to the feeling of frequent urination or the frequent desire to pass urine with little or no urine coming out. If the urine passage is being blocked by a stone, then the patient will have inability to pass urine. If the urine infection is complicating the presence of stone, then the patient may have a foul smelling or a cloudy urine, or they may develop fever. Severe pain can lead to vomitings also. If the stone pain is causing kidney damage, the signs of kidney damage may be there, like breathlessness, edema over the feet or over the entire body, feeling of tiredness, and all these things. Now, important thing is to understand whatever be the signs of symptoms, if you are feeling that you have a stone or you have a doubt, do not neglect it. See a specialist so that he can do the appropriate test and advise you accordingly. In my next video, I shall be talking about the tests needed to diagnose a stone in kidneys or in the ureter. Do post questions if you have some doubts. I shall not be able to reply on direct medical queries, but I'll be more than glad to reply on health related concerns. Till then, keep following Urology Solutions with Dr. Vipul. Stay hydrated, stay healthy.